In this video, we're going to talk about lavender for sleep and anxiety. Herbs and botanicals have been used in traditional systems of medicine for centuries. But what does modern science say about them? Have you ever wondered about this? If so, go ahead and subscribe to my channel so you can keep on learning. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. And this channel is all about holistic, science-based strategies to optimize your sleep and your mental health. Every video also contains a tip for physicians and healthcare providers. Before we jump into the video, I'd like to invite you to grab my free holistic sleep guide. The guide is available on my website at IntraBalance.com, and the link is also in the video description. This is the second video in a 4-part series on supplements for sleep and stress. If you haven't already seen the first video, go ahead and check that out after this one. Lavender is a plant that has been used for centuries to treat sleep, anxiety, depression, among many other medical conditions. It can be taken orally as a dietary supplement. You can also use it as an essential oil in aromatherapy. You can also apply it topically directly to your skin, and you can also take it as a tea. Lavender is shown to reduce anxiety, to reduce stress, even to reduce pain and inflammation, and it is also shown to promote sleep. In addition to all of these benefits, lavender is also shown to have antibacterial properties and neuroprotective effects. A few ways that it works is that it helps to relax blood vessels. It enhances GABA, which is a neurotransmitter that is involved in the relaxation response. It's also shown to reduce the blood pressure and slow down the heart rate. And it also helps to balance the sympathetic and the parasympathetic nervous system. The sympathetic nervous system is the fight, flight, and freeze response, and the parasympathetic nervous system is your rest and digest response. There are even some preliminary studies on lavender comparing it to modern medication. And some studies have shown that lavender is as effective as the benzodiazepine Ativan or lorazepam. It's also been shown to be as effective as the medication paroxetine or Paxil, which is a selective serotonin reuptake inhibitor or SSRI, which is used commonly for anxiety. Other studies have shown that lavender helps to improve sleep quality, reduce sleep disturbances, and enhance slow-wave deep sleep. That is your deep restorative stage of sleep. Do you ever use lavender? Go ahead and jump into the comments and let me know. Okay, so how do you actually use lavender? As I mentioned before, you can use it as an essential oil in an aromatherapy diffuser. I actually love using an oil diffuser in my bedroom, and I put a few drops of essential oil in there. And you want to make sure that whatever lavender you're using is natural, because it's actually the natural compounds in the actual oil from the plant that have the beneficial effects. So you want to stay away from anything that's like a synthetic or a fake lavender scent. And if you're using aromatherapy, you want to make sure your room is well ventilated. When using lavender topically, if you're applying it directly to your skin, you want to make sure that it is diluted. It's not a good idea to put the concentrated essential oil directly onto your skin. So make sure you're using it in the proper format. And again, that it is the natural lavender compound and not a synthetic fragrance. Lavender is also available as a dietary supplement that you can take by mouth. As far as side effects to look out for with the oral supplement, it can cause some GI upset and maybe even some lavender flavored burps. And then as far as applying it topically, just be careful because it can cause some skin sensitivity, allergic reactions, or even sensitivity to sunlight. Here is your tip for physicians and healthcare practitioners. The oral form of lavender is called Silexin, and it comes in 2 doses, 80 milligrams and 160 milligrams. Lavender may have hormonal effects, so you want to avoid use or be very cautious with patients who have a history of hormone-sensitive cancers. There have also been case reports of pre-pubertal gynecomastia with repeated application of topical lavender. I actually have a patient whose daughter went into precocious puberty from continual use of lavender. So be very careful in your child and adolescent population as well. And then lavender may also potentiate the effects of sedatives and narcotics. So as always, use caution with patients who are taking those classes of drugs. There is no one quick fix for improving your mental health or improving your sleep. There's no one herb, supplement, botanical, or medication that is going to improve those things. But when used as part of an integrative and holistic treatment plan, lavender may be an effective tool. So talk to your doctor if you're interested to learn if lavender is right for you. If you found this video helpful, go ahead and give me a thumbs up by clicking the like button, and then go ahead and check out the rest of this series on supplements for sleep and stress.